Hello, everybody. Dr. Anthony Cave here, your Stanford and Harvard trained anesthesiologist and innovative medicine specialist. And I'm going to share with you some personal stories about why medical school is sometimes a failure. Not a failure in terms of it being fake news or misinformation or wrong information that they teach your doctors, but a failure to patients, a failure because the medical system in the United States, at least, is by and large, in many ways, a failure. And medical school is a feeding ground, a funnel, if you will, for doctors to come out delivering substandard care. Not because doctors are poorly trained from knowledge, but poorly trained with respect to wisdom. And patients want wisdom. Patients deserve wisdom from their doctors. It's certainly what you deserve if you've ever been to your doctor in pain, with a heart or a lung problem, for surgery, for mental health conditions. But at least when I was a medical student, and I think it's still the same way, we come out being blind followers to a medical system. And blind followers typically can't be wise doctors and stewards of good, compassionate medical care for doctor. So when I was a third year medical student, I had this experience that I'll never forget. And just so you know, the third year medical school is this um, challenging, to say the least, year, because at least when we went through medical school, it might be different now in some new age type programs, but you go through all of the textbook learning, and then finally you get thrown into the hospital to see real life living, breathing patients. But you don't really know what to do yet. So you have to learn on the fly, learn on the job. And I had this patient who was an elderly gentleman in his probably 60s, early 60s, and he came in with congestive heart failure. So, for those of you who don't know, congestive heart failure is pretty bad, not a good long term prognosis. It's when your heart can't beat well enough to circulate blood effectively throughout your body. So, if blood can't circulate throughout your body effectively, it can lead to a backup of blood. It can actually lead, in some cases, to what we call cardiogenic shock, which can be life threatening in some forms. And you've probably seen this if you've seen some people with these giant ankles. You've seen these like really, really thick ankles, and until they elevate their legs, the legs won't reduce their swelling. It's because the blood is staying in the legs for so long because it's not effectively circulating that it leaks out of the vessels. It can happen in your lungs as well. When it happens in your lungs, it can be life threatening because you can literally drown. You can have what we call a cardiogenic cough, cardiogenic pulmonary edema. By the way, Ali is asking, how long are you in medical school? You know, I did 5 years because I did a research year at Stanford. It's typically 4 years in the United States. And Elizabeth, good to see you on here as well. Irene, I'm doing well. Thank you. Darian, I'm Devil Woman. Paul, and of course, Heidi. Thank you, everyone, for coming on. So, this patient came in with cardiogenic shock from their congestive heart failure. And I'm here trying to question them. Why did they have heart failure? Now, this is very important, guys. We need to figure out why things happen. We'd like to think because we want to get to the root cause, but I'm going to share a secret. And I'm really sorry to say this, but it's hard to get reimbursed for your treatment if you don't have a reason for what happened, because it's hard to charge insurance for your management if you don't have a reason. This is not the only reason why doctors diagnose things and try to figure out the root causes. Unfortunately, and it breaks my heart, I'm being completely candid with you, we're not in the business of trying to figure out the root cause of disease. We are not in the business of figuring out the root cause to cure illness. And this breaks my heart every day. I can't even begin to tell you. And it starts in medical school. I'm not saying medical school is bad. I'm not saying medical school is wrong. The medical system does not encourage this type of thinking in anywhere, in nurses, in physician assistants, and nurse practitioners, nor in doctors. For the most part, of course, there are exceptions. But this patient comes in cardiogenic shock, and I'm thinking, I need to report to my attending physician, the one who's going to give me my grade at the end of this rotation. This was my internal medicine rotation. I need to figure out what is going on so that I can report back to my attending physician. So I ask him everything. When did the chest pain or when did the trouble breathing start? When did the swollen ankle start? When What do you think happened? Have you been taking your medications? Did you have any chest pain? Did you have a heart attack? I'm just like fishing here for some answer. Sadly, and I'll be honest, and like, I mean, I would say I'm ashamed of it now, but I really had no idea in medical school as a third year. I'm not trying to figure out the answer to help him. I'm trying to figure out the answer so I can report back to my, you know, grade master, my attending physician. I'm being honest with you. It's unfortunate when you're just there to get, you know, everything that matters is the grade at the end of the day when you're a medical student. Unfortunately, because you got to get into residency, you need to have good grades to get into residency. So I finally figure out, oh, this gentleman hasn't been taking his medications properly. That's why his heart decompensated. So I am like, oh, finally, I figured out the answer. Go to the attending. I present the case, what I think is going on. Fine. I get whatever satisfactory grade I get. I don't even remember what it was, but we get the patient out of a dangerous place to a safe enough place to go back home. So this is good, right? Patient goes back home. Uh, Insurance pays bills to the hospital because that's what this is unfortunately about in many cases. Patient comes back less than a month later and dies in the emergency room. So this throws me for a spin, and I hope if any of you are listening, if you know that coming to the emergency room, what we call a bounce back, is very expensive monetarily. One, two, it had better make you wonder what are doctors doing in the first place when they're fixing problems, sending people home, and they just come back a couple weeks later. I mean, coming back dead is even worse, obviously, but well, what happened here? Well, it turns out this patient had cocaine in their urine. I don't remember when it was tested at some point. I'm sure in the ER someone got I got a urine sample. And if you don't know, cocaine, methamphetamines, any type of stimulants can put a lot of stress on the heart. And if you already have a tenuous heart, that can just tip the heart into heart failure again or cardiogenic shock, ultimately leading to death, which is what we believe happened in this patient. Now, where's the failure here, right? The whole point is like doctors, unfortunately, you know, we live in an ivory tower. We are like above the common person. Not all doctors, right? But there's this real unfortunate sense of divide. I'm not saying doctors shouldn't be respected. Yeah, people with good character, with formative education, who are compassionate, who are, yeah, of course they deserve respect, just like hopefully I deserve respect, you deserve respect, of course. I'm not saying that physicians are dirt. I'm not saying patients are dirt. But I'm saying that there is this disconnect with reality. The failure of the system is a fundamental disconnection with reality. Nobody asked this patient about their drug use. I mean, you would think it's common sense. Hey, you have congestive heart failure, you probably shouldn't be using meth or coke. I mean, you know, I would think it's common sense, but common sense means what? In my ivory tower, it meant common sense. So I'm sure this individual patient knew that coke wasn't good for their heart. Did anyone think why were they using coke? What was the addictive history behind? You know that addictions are merely symptoms of a deeper problem. No one taught me this in medical school, and I had amazing teachers. I am so blessed. I really am grateful for my medical education. I am so grateful for it. It was so powerful, but it's still lacking. The wisdom is lacking, the experience. Remember, wisdom is knowledge plus experience. When someone's addicted, it's not about the addiction to cocaine that this patient had that caused them to die with a huge medical bill, utter waste of resources. I mean, complete waste, waste of human life, of precious human life. There's sanctity in human life, right? So, no one taught me addiction is a symptom, Anthony. It's a symptom, it's not the root cause. This patient was seeking something. Remember, if you could cure addiction by just giving people what they're addicted to, we wouldn't have drug addictions. We wouldn't have gambling addictions. We wouldn't have shopping addictions or sex addictions. As Gabor Mate says, you can just bring two sex addicts together. It should solve the problem, right? It doesn't. It doesn't solve the problem. What was this patient ultimately seeking that cocaine was giving them a quick fix for is a mystery I'll never know because they're dead. So, what is the failure? The failure is that we don't get wisdom. Now, let me tell you something specifically about medical school in the West. Oh, and by the way, I see a whole bunch of comments. Bonita, having a heart cath in a few days. Bonita, I'm sending you positive vibes. I hope everyone here is sending you positive vibes as well. Hopefully, your heart cath is clean and there aren't any blockages in there. Wishing you the best. And Greg, good to see you on here as well, crazy cat lady. Steve Trumbull. Um, and yes, Steve is right. I wouldn't have thought that a 60-plus-year-old with heart failure would have a cocaine addiction. You are correct. Um, Callie Cat. I wish you the best for your heart transplant. Oh my goodness. Please, everyone here, send Callie positive vibes for her heart transplant at Stanford. Um, all right. So here's what you need to know about Western medical school. It is so powerful for treating patients in the Western biomedical model. So for those of you guys who are watching and have the video, you'll see my portable ultrasound. I've scanned myself so many times. You've seen them. I did one on nerve blocks. I actually did my own heart. I showed you my heart beating live for you. You can check it out if you're interested. Or the breathing tube like this one that I'm holding. We are so good at doing interventions. It helps that you can bill for them, by the way. But putting that aside, we're very, very good at doing interventions that are expensive, that can be life-saving in the right time. No question. I am so grateful that I was taught these valuable skills. But this is a failure because when used out of context, like for chronic medical conditions, for conditions that have root causes that aren't addressed, these interventions and these medications can have side effects that are very serious. They can have huge expenses, what we call wallet biopsies. They don't address the root cause of disease. Patients feel gaslit and unheard. I hope that's never been you, but boy, is this a huge, huge concern that I hear on social media. And this disempowers patients because instead of looking to themselves for what we call an internal locus of control, we foster an external locus of control in medications, in interventions, in devices, the latest Apple Watch or this monitor or that. Hey, these are great monitors, but they're not addressing the root cause. Knowledge is often one way to empower patients. It's what I do on this channel, as you know. And by the way, I would greatly appreciate it if you quote, hit that like button. I don't like to do product placement. I don't want to serve ads because this knowledge I want to be available without there being some bias from another party sponsoring it or anything. So you're spreading this knowledge to others is all I ask for. If you could hit the like button, I'd certainly appreciate it. Or follow, share with others so they follow. Always appreciated. But first and foremost, please be an advocate for yourself and those around you and your loved ones with this knowledge. So, what does medical school not teach? Listen up closely because this is huge. This is where the experience plus knowledge equaling wisdom falls apart. Medical school is mostly books, and it should be. That's appropriate because residency is when you get real experience with patients, when you're really in the trenches doing things with your hands, talking to patients, etc. And that's where the knowledge of medical school, the experience of residency leads to the wisdom of a doctor. That's powerful. That's good stuff. It's not enough when we have patients living in a real world, not in the ivory tower. What do I mean? You have an opioid epidemic. When in medical school residency, we get taught about addiction the way that I just shared with you. We have an obesity epidemic. Well, how much of addiction to foods and cultural values that are sometimes malaligned, or perverse incentives from public health initiatives that have gone awry, or corporate greed? We don't talk about this. Heck, we still have cafeterias and hospitals that are serving the same garbage that we're telling patients not to eat. So they come to the cardiologist appointment and then they go downstairs and they grab like fries and a hamburger in the hospital cafeteria. I hope the insanity of the situation is not lost on anyone here. How about drug prices? We can diagnose that patient, by the way, with a cocaine addiction. I forgot to tell you, they couldn't afford their medications either. What do patients do when they can't afford medications? They skip them. They don't refill the prescriptions. They end up in the hospital. So I never was taught, how are drug prices set? How do the insurance companies work? How much is just completely wasted? Almost 20% of the United States gross domestic product goes to healthcare, and 25% appears to be complete waste. Waste in the sense that it's not going back to patients. Yes, it pays for ancillary insurance-based personnel, and of course, they're human beings that deserve an income. They shouldn't work for free. I'm not advocating that, but it's not going to patients. It's not. Patient care would not change. 25% of 20% of the US gross domestic product, correct me if I'm wrong, but it's 5% of the United States GDP is complete, utter waste. They didn't teach me this in medical school. They didn't teach me about patent extenders, about all these games that pharmaceutical companies play with Me Too drugs. You should check out my video on it about why ketamine is so expensive. Very fascinating about all these games that you, the patient, you are paying the price for. So, how can doctors be level with patients if they're not trained with the experience of what the real world of medicine is like? Why don't doctors just run their own clinics to deliver care the way they want, so they're not bound, in these handcuffs to the hospital system? Have you ever thought of that? It's Yeah. Why does that not happen? They didn't teach me this in medical school or in residency. Why is it so hard to contact your doctor? Why can't you just like send a text? In my clinic that's privately run outside of insurance, I do have that privilege with my patients. In my ketamine infusion clinic, there are no hoops, but that's very, very rare for some of them valid, some of them not valid reasons. I hope that you appreciate that doctors aren't bad, but of course, and doctors start medical school, I hope, with compassion and curiosity and a passion for helping humanity, absolutely. But burned out doctors can't change the system. And burned out doctors deliver substandard care. They're more likely to make medical errors. So, who suffers the most at the end of the day? Yes, when physicians commit suicide through this broken system, obviously it's a one-way street. It's horrible for them. And I have a whole video on that you can check out. But patients suffer. Patients suffer when doctors are burned out, when nurse practitioners and nurses and physician assistants are burned out and spinning in a wheel of not helping patients out in the long run. So John Steinbeck wasn't a doctor, great poet, local to California. You should read his work. He said, you can only understand people if you feel them in yourself. You can only understand people if you feel them in yourself. I wish I was taught that in medical school or in residency. I mean, I'd like to think that I knew it before, but I don't think myself or my colleagues ever got the memo in the same gravity that the rest of the medical education was given to us. Well, what do you think? And by the way, let me know. I see all the comments here, but let me know if you're watching this afterwards. What do you think? Have you ever had a situation where you felt gaslit by your doctor? Where you felt that your doctor wasn't hearing you because they were too busy, maybe in their own ivory tower? And I don't mean arrogance necessarily. You just get so wound up in having to please the hospital administrators because doctors need to get paid. And if they don't please their bosses, they're not going to get paid. Reality. I wasn't taught this. Doctors have quotas. And if they don't meet their quota, they had to get called in to the C-suite in a hospital setting to explain what's going on. How do you think that impacts your care? When you aren't a quota, you are part of a quota. This is why I don't operate in that system personally, because it breaks my heart, doesn't help my patients. But I do hope that you feel empowered to advocate for yourself. If you haven't watched my videos on how to communicate with doctors, asking for pain meds, asking them the hard questions, because no one else has more agency over their health than you yourself, typically, in most, not all cases. So once again, I would appreciate your support in sharing this inspiration with others, that you really have tremendous power. And it starts with this type of knowledge. I'm going to answer your questions in a moment here. A whole bunch have come in. But like before, if you could hit that like button, I would greatly appreciate it. And subscribe to keep up with all of my unscripted live streams. Linda, I am so sorry about your doctor who messed up your surgery. For those of you that know, it's a very unfortunate case, but it's not too uncommon, unfortunately. Sushila is getting a Watchman implanted under general anesthesia. We're wishing you the best, Sushila, and I hope everyone here is also wishing you the best. Blue Omega is thumbs upping mental power. Yes, watch my videos on placebo effects, on psychedelic medicine, on what comes out under anesthesia. There's a tremendous amount of power that patients have that we weren't taught in medical school. Taylor, good to see you. Fallon has left a couple comments. PTSD from surgery. Fallon, I'm very sorry about that. If you're comfortable sharing your story, uh, we'll all benefit, I'm sure, from learning about it. But you're right. Some doctors do have huge egos, just like some software engineers have huge egos. Some lawyers have huge egos. Some patients have huge egos. Entitled patients are not free of blame any more than entitled doctors are free of blame. So, like I said, if we're going to judge, it should be based on character, knowledge, respect, etc. Not that we should necessarily judge, but if we're going to be attributing some sort of respect for others, it should be on character, not necessarily on labels alone. Leslie Hyde, why I say doctors should rule out zebras before horses as the cause of patients' problems. I went nearly 4 months vomiting many times a day. Severe nausea, only mildly relieved with consuming salt. Leslie, I'm not familiar with what you're getting at, but the case of zebras is very, very challenging. And it's a whole different discussion for how diagnosis works in medicine. Um, Lori says, relatively new to your channel, had many surgeries. Lori, I'm sorry that you've had so many surgeries. I hope your recoveries have gone well, and that you've never had any PTSDs from those surgeries. Callie, I'm happy to hear that you've always loved your anesthesiologist. I am Devil Woman is saying, I need a nice long bath to relieve stress. I appreciate it, but I am so okay because I don't have to participate in the system that I'm describing. I mean, I still do because not everyone can afford out-of-pocket care, and I still provide care in the insurance system to those who can't otherwise afford it. But I am really grateful to be able to have a way that is relatively cost accessible to many patients. Dort says, veterans at the VA get a new baby. Ortho told me to wrap myself in bubble wrap, had to pay out of pocket and worth it. Life is short. I don't know what you mean, Dort, but if you can explain that to others, I'm sure we'd all benefit and learn something new. Adrenal insufficiency is what Leslie Hyde has, her zebra. I'm sorry that you have that, but it's not all that rare. I don't think adrenal insufficiency, it should really be a zebra. But certainly the salt would explain the underlying diagnosis. Allison, thank you for the kind comments. And Mary Waters, I don't think I've seen you on here before. All of this explains everything I've thought about my own doctors for years. Yes, Mary, that is why I am sharing kind of this back door, if you will, about what is missing in the medical system. Where is the wisdom? Where is the wisdom that doctors have by feeling their patients, understanding people if you feel them in yourself, like John Steinbeck said? Why is POTS so hard to identify, says Heidi? Because we don't really understand POTS. When we don't understand a quote diagnosis or a pathology, it's hard to diagnose it because the criteria are relatively vague. And it's also hard to treat it. Good question. I wish I knew more about POTS. I really don't understand because no one, as far as I know, really understands. F. Lassie. Can a person with chronic depression undergo surgery where ketamine is used without their knowledge and wake up with the depression relieved for a matter of weeks? What a good question. Short answer, kind of, yes. But depends on many other factors. I've actually had multiple patients come to me who have had ketamine. It's exactly what you said. They didn't know why they felt better after their procedure or surgery, only to find out months later that they received ketamine during the procedure. Fascinating. Fascinating observation. Fascinating. Lori is having a meniscectomy on Thursday, a little nervous about anesthesia due to sleep apnea. Supplemental oxygen. Well, Lori, I'm wishing you the best for your surgery. I hope everyone here also sends you positive vibes. I have a lot of interesting videos that might be helpful for you to overcome some of those fears. And I really wish you the best. Thank you for your vulnerability and sharing what's happening to you on Thursday. Mary Fernandez. Yes, I see you're agreeing. Dory has PTSD from working in surgery. From working in surgery. Dory, I'm sorry that you have PTSD from working in surgery, but imagine having surgery and what stress that must have on the body. The body keeps score, whether it's central sensitization, wind-up phenomena, which I described recently in some videos. We're beginning to find some real ways that the body truly keeps score. And that trauma can come out weeks, months, years later. And Denise, adrenal insufficiency, likely due to undiagnosed Ehlers-Danlos and POTS and mast cell activation, trifecta in my experience. Denise is bringing together some of the greatest mysteries of medicine in a trifecta, and she's correct. Still, to me, doesn't explain the underlying root cause. I wish we knew more, and I'm sure one day we will. Disassociatives are wonder workers in the right circumstances. Doc D0, very fascinating that you said that. I really want to talk about that in the future live stream. Disassociation. You know, when you're in a ketamine state, you are disassociated, and that can provide tremendous relief to mental and physical struggles. You can also have similar levels of disassociation without medications at all. It's going to be cheaper and safer than receiving ketamine. Even though I think ketamine is great, don't get me wrong, there's a time and a place. And in medical school, sometimes they teach us this to, I'll share one more analogy for you because you'll find this interesting. They say when you're a hammer, everything looks like a nail. Have you heard that before? Let me know. Have you heard that before? When you're a hammer, everything looks like a nail. So imagine being a surgeon, imagine being a pain specialist, imagine being an anesthesiologist, being an integrated medicine specialist. I'm not immune to this, my friends. I am not anything special. I'm just trying to level with you and share ways that you can be more empowered to advocate. So, and so some people have, some people haven't. When you're a hammer, everything looks like a nail. So whatever you do, you will see it in your environment. When you're a surgeon who wants to inject platelet-rich plasma, well, when you have a patient that vaguely seems like they might benefit from it, you will push it. I'm not even saying it's wrong. In the right context, it can be appropriate. I'm not saying surgeons are bad people. I have many surgeons that I would trust myself and my mother and my family with. They're great, great people. But it's just a human bias that I have as much as the next doc, as much as the next patient, because patients come in with biases as well. Patients aren't immune. Don't think for one moment that doctors are only in the spotlight. So are patients, right? That's why we have to all work together and not butt heads. Irene is saying hammer ouch. I agree, Irene. So with that said, thank you everyone for your support. We'll be back on again, I'm sure, very soon. Please leave your comments about what you want to hear in the next live stream and fill out the polls that I leave up there. Your support means a lot so I can do this more often. Until next time, remember that you have more power over your health than you've probably ever been told.